Tummy tuck is another word for abdominoplasty procedure. This is a surgery designed to remove loose skin and excess fat from the front of the abdomen and also correct stretched out loose muscle. Essentially, anyone who has stretched out loose skin of the abdomen can benefit from this procedure. Typically, my patients fall in two different categories. One is women who've had pregnancies in childbirth, and second category is patients after massive weight loss, and that can be in both men and women. A tummy tuck by itself takes about 2 to 3 hours to perform. But I hardly ever perform this procedure in isolation. I will almost always combine with liposuction of the waist area, and in most patients I would recommend doing it along with liposuction of the flanks and the back. The recovery time for tummy tuck does vary from patient to patient. Patients are expected to relax for the first week at home, but also doing the normal daily activities. And by the time 2 weeks come around, most patients are able to go back to a desk work. There's definitely no heavy lifting of 20 pounds or more for at least 6 weeks after the surgery, and no core activity for 6 weeks as well. The swelling starts to go down by 2 weeks, and they start seeing a smaller and smaller waistline, and final results are seen at about 3 months. When evaluating the patients for suitability of surgery, I take a detailed look at their medical history, and I also have them see their primary care doctor who can optimize their health, do the necessary blood work and EKG if needed to make the surgery as safe as possible. I see a lot of surgeons performing this procedure as a simple removal of fat and skin and stitching up the patient without much focus on creating beautiful contours. I see tummy tuck and body contouring in general as an art form. I love the reaction when patients wake up from surgery and immediately look down and see the new contours and their new cute little belly button. I'm quite proud of my technique of reattaching the belly button to the outside skin surface, where instead of having the belly button come to the surface, I actually have the skin diving deep to the muscle level where the belly button is tucked in, creating a very tucked in, almost invisible scar. I would say universally, patients are so happy with the results. They love the new toned abdomen, their contours, their balance in proportions. Once the muscles are repaired and back in the midline again, a lot of patients have also seen a decrease in their back pain. They haven't realized that they were suffering from back pain because of stretched out muscles of the abdomen that wasn't providing any core support. And now they have this internal core set that is providing excellent support with a decrease in back pain.